Health Psychology is very much at the forefront of those important issues we are facing as a society.
The psychological element of illness is often underrepresented, and understanding the mind is really important to the physical outcomes of a lot of illnesses.
We need to be adaptive to our environment, our surroundings, and how times change. So we're looking at the biggest spectrum of what makes a person well. And that's what our programme does. It helps us to understand how we can motivate individuals to live a healthier lifestyle.
The Masters in Health Psychology is BPS-accredited. It's looking at behavioural, psychological and social factors that might influence physical health, illness and healthcare provision.
You'll think about health psychology approaches, whereby you learn the real fundamental underpinnings of what health psychology is.
Advanced research methods in applied psychology in terms of qualitative and quantitative methods.
We also have health psychology interventions. That's where you actually have a go at creating your own intervention. You're using the state-of-the-art equipment, fantastic laboratories, and you're really being taught by those world leaders in that area.
All the lecturers were so knowledgeable about everything. You knew you could go to them and ask something and they'll always have the correct answer for you.
In semester 3, our students go off on a 16-week placement, where they also collect their data for their dissertation.
I've really enjoyed my placement with Somerset Council in the behavioural science team.
I'm at Dorothy House Hospice as a research assistant.
Dorothy House is a hospice, so we want personalised care for people, and we really love having students come and work with us.
The placement opportunity just gives you the chance to apply all the knowledge that you've learned across the year, and it's really rewarding.
Learning communication techniques and theories that I've then seen in real time helping people.
We always see increased confidence and also excitement about where they'll go to next.
The skills they develop while on placement see them then go to secure other jobs.
Graduates have gone on to do doctoral work, and we've had students do research at the Office for National Statistics.
Students go on to work in the charity sector, perhaps at the local authority and the councils.
You can incorporate psychological theories and influence policy with that.
Thinking about how health psychology can really benefit the community.
I want to work with people in public health.
I've just been offered a job as a public health practitioner in substance use and mental health at Wiltshire Council. That was exactly what the dream was.
The next generation are pushing the boundaries and are just amazing.
They'll be able to solve whatever the problem is that the organisation is facing.
Any opportunity to use the knowledge that I've learned here at Bath in the community and wider populations is something I'm really passionate about.
These people coming through and studying our programme, they'll take health psychology to the next level.